Hello and welcome to The World Today, everyone. I'm Richard Nta in Nairobi. Let's begin with our top story. Iranian media reports that Iran's Revolutionary Guard has launched a drone attack on the U.S. Fifth Fleet in Bahrain, as well as military bases in Jordan and Kuwait. The IRGC also vows retaliation for any future U.S. attack. This came after the U.S. military said it had carried out what it calls self-defense strikes against Iran. President Donald Trump said Tehran shot down a U.S. Apache helicopter near the Strait of Hormuz. Trump said both pilots were uninjured and that the U.S. would respond. U.S. Central Command described the strikes as a proportional response to what it called unjustified Iranian aggression. Iran's state media reported attacks on Qeshm Island and the port city of Surik, with explosions heard near Bandar Abbas. Iranian Foreign Minister Saeed Abbas Araghchi said foreign forces in the region risk accidents or crossfire, adding that the best way to reduce that risk is for them to leave. Jim Spellman has more on this.
President Trump wrapped up his social media post by writing, quote, "Nevertheless, the United States must of necessity respond to this attack." And a few hours later, the U.S. military posted on social media this, quote, U.S. Central Command, CENTCOM, forces began launching self-defense strikes against Iran at 5 p.m. Eastern Time today at the Commander-in-Chief's direction in response to yesterday's downing of a U.S. Army Apache helicopter. The mission is a proportional response to unjustified Iranian aggression. Iranian media soon reported missile strikes as well as air raid sirens going off on coastal cities, including Qeshm Island, Bandar Abbas, and Surik. The targets appear to be military and naval bases, radar stations, artillery batteries, and at least some water storage tanks. Shortly before 9 p.m. Washington time, CENTCOM announced that its attacks had been completed. President Trump at times struck a defiant tone, as we heard on social media, threatening to attack Iran, but at the same time telling the Wall Street Journal that the Apache helicopter incident wasn't a big deal, and also saying that peace negotiations continue to go well and he expects a deal in the coming days, though, of course, we've heard that many times in the recent weeks. President Trump's staff also telling several U.S. media outlets that the attacks from the U.S. perspective should be seen as a warning shot, and the White House expects peace negotiations to continue.
Israeli strikes have killed at least 16 people and injured dozens more across southern Lebanon on Tuesday. The deadliest single strike killed 8 people in the historic port city of Tyre. Minutes after the attack, Israeli forces ordered the entire city to evacuate for the first time. The Israeli military did not explain why the strikes happened before the evacuation order. The Lebanese Public Health Ministry says more than 3,600 people have been killed and over 11,300 injured by Israeli attacks on Lebanon since March the 2nd. The government is in U.S.-mediated talks with Israel to reach a peace deal, despite opposition from Hezbollah, which calls the talks a farce. Hospitals across Gaza are struggling to maintain essential services amid limited medical aid entering the Strip. Shortages of fuel, medical supplies, and equipment are forcing critical departments to suspend operations, putting patients at risk. Nadra Al-Tibi reports from Gaza.
Inside Al-Aqsa Martyrs Hospital, doctors say shortages of fuel and equipment are limiting the hospital's ability to provide healthcare services. The impact is being felt directly by patients as hospitals delay surgeries or reduce services.
Because of shortages of generators, hospital beds, and medical equipment, my surgery has been postponed more than once. For patients like us, this is extremely dangerous.
According to the Palestinian Health Ministry, the limited medical aid entering Gaza consists mainly of basic medicines and fluids that fall far short of actual needs. Officials say drug shortages have reached nearly 50%, while the shortage of medical consumables stands at around 60%.
In Gaza hospitals, including Al-Aqsa Martyrs Hospital, nearly 50% of healthcare services have stopped. The lack of generators is a major threat to patients' lives. Unfortunately, the surgery department has been forced to suspend operations.
Health officials say shortages of medicines and medical supplies have contributed to the deaths of more than 1,000 patients, and over 20,000 others remain on waiting lists for medical referrals outside Gaza.
Israel, as the occupying power, has an obligation to ensure that Palestinians in Gaza have their basic needs met. That's their basic needs in terms of access to food, to water, to shelter, but also health services. And health services need electricity to run in order to get the electricity to power the hospitals, to power the health facilities. They need access to generators and the fuel and the oil that keep those generators going.
The World Health Organization has warned of a worsening health crisis in Gaza. It notes that only about half of the territory's hospitals remain partially functional, while none are operating at full capacity. As life-saving medicines remain blocked from entering Gaza, 2 million Palestinians face the growing spread of disease and worsening shortages in healthcare services amidst ongoing restrictions on Gaza's crossings. Nadira Tibi, CGTN, Gaza.
Philippine authorities say the death toll from Monday's powerful quake that struck the southern island of Mindanao has risen to 45. At least 487 people have been injured and tens of thousands displaced. Richard Nta has more from General Santos City.
Well, cleanup operations are now underway here in General Santos City. So behind me is one of the buildings that collapsed during the height of the 7.8 magnitude earthquake, and it housed a radio station on the upper floor and a fast food chain on the lower ground level. So heavy equipment is now being used to clear the rubble and remove debris from the site, and this is not an isolated case. Across General Santos City, dozens of structures like this have either collapsed or sustained significant damage, with crews continuing assessment and clearing operations. So strong aftershocks continue to rattle parts of Mindanao, particularly here in General Santos and nearby Sarangani and South Cotabato provinces. And just around 10 a.m. this morning, a magnitude 5 earthquake was strongly felt here in General Santos, sending people rushing out of homes, offices, and commercial establishments as buildings shook. So the Philippine Institute of Volcanology and Seismology says they have recorded close to 600 aftershocks since Monday morning following the major earthquake. So the continuing tremors are also hampering search and rescue operations here in General Santos City. 2 people were trapped inside a collapsed 3-story grocery store. We have received reports that the body of a male employee who was just recovered a few hours ago, while the store's 27-year-old female manager remains trapped beneath the debris. Officials say they have not detected any signs of life, but rescue crews continue carefully combing through the wreckage.
Chinese Foreign Minister Wang Yi has called for improving understanding and fostering mutual trust through dialogue. Wang made the remarks at an event on Monday marking International Day for Dialogue Among Civilizations, which falls on June the 10th. He urged all sides to promote unity and seek consensus through exchanges and continuously strengthen the public and cultural foundation for building a community with a shared future for humanity, especially in the face of unprecedented challenges. Wang outlined a 4-pronged approach to advancing dialogue among civilizations. He said that all sides should uphold mutual respect, promote harmonious coexistence, and stay committed to a people-oriented approach. Wang also called for efforts to carry forward and innovate traditional culture and stressed the need for exchanges and mutual learning while improving the mechanism for dialogue among civilizations. The day was established in 2024 by the 78th UN General Assembly following a resolution proposed by China and co-sponsored by over 80 countries. And an event to commemorate the UN International Day for Dialogue Among Civilizations was held in Geneva. More than 200 people, including senior diplomats from over 50 countries, heads of international organizations, and journalists attended. China's permanent representative to Geneva, Dia Guide, World Meteorological Organization Secretary General Celeste Salo, and UN Geneva Director General Tatiana Valavaya addressed the event. They discussed revitalizing the study of ancient civilizations and called for cultural understanding to support effective governance. The event featured exhibitions on Chinese seal carving and Dunhuang culture, as well as martial arts, music, dance, and fashion performances. Against the backdrop of Greece's ancient temples and marble monuments, the world looks to the past for answers to the challenges of the future. Evangelos Sipsas reports on Tuesday's opening of the Second World Conference of Classics in Athens.
Beneath the neoclassical columns of the Academy of Athens, the opening ceremony began with a message that ancient civilizations should not remain confined to history books. More than 200 academics, officials, and cultural figures from over 20 countries are attending the two-day gathering, jointly organized by Greek and Chinese institutions.
Classical studies are not relics of the past. They are a necessary investment in the future because they provide the intellectual tools we need to address the complex challenges of our time.
Under the theme Dialogue Between Ancient and Modern, the conference is examining education, social responsibility, peace, and technological change. Speakers also highlighted the growing cooperation between Greece and China in research, culture, and classical studies.
Through modern interpretations of humanity's ancient classics, we can awaken classical wisdom and guide the ship of human civilization as it cuts through the waves, advancing steadily toward a distant future.
Standing here at the Academy of Athens, the central question is not what ancient civilizations left behind, but whether their ideas can still guide our societies facing artificial intelligence, geopolitical confrontation, and social change. Artificial intelligence emerged as one of the opening ceremony's strongest themes, with speakers warning that technological progress must remain anchored in human values.
In the face of artificial intelligence, what should concern us most is whether our humanistic traditions can be preserved. We must not allow technology to become a runaway horse, racing uncontrollably toward the abyss.
The message from Athens: classical wisdom may not provide ready-made answers, but it can still help humanity ask the right questions. Evangelos Sipsas for CGTN, Athens.
Well, that is it for this edition of The World Today. I'll be back shortly with more news from the continent in Africa Live. Thanks for watching. South Africa police say 12 people killed in mass shooting in Johannesburg. The WHO says confirmed Ebola cases rise to 550 in the DR Congo. And cholera cases rise in Nigeria's Borno state despite emergency response. Hello and welcome to Africa Live. As always, great to have you with us. I'm Richard Nta, live in Nairobi. And for those of you joining us from across the continent and around the globe, we thank you for joining us. Let's take a look at other stories making headlines this hour. Coming up in business, inflation in Egypt slows down in May, defying shocks from the Middle East conflict. And in sports, Somali referee Artan gets heroes welcome in Mogadishu after he was denied entry into the U.S. for World Cup duties. Once again, a very warm welcome to Africa Live. We start in South Africa, where at least 12 people have been killed and 9 injured in a mass shooting by gunmen in Cleveland, east of Johannesburg. Police say they are conducting a manhunt for more than 10 suspects linked to this informal settlement attack. According to a police statement, the gunmen arrived in a vehicle late on Tuesday before opening fire indiscriminately. So far, the motive of the attack is unknown. South Africa has one of the world's highest murder rates, averaging about 60 a day. We have our correspondent Julie Shire in Cape Town who joins us live. Julie, welcome to the program. Thank you for joining us. Tragic and disturbing news coming out of Johannesburg, to say the least. Julie, what more can you tell us about the shooting? What do we know?
Well, as you mentioned, Richard, this is devastating news. Police believe this was an organized and targeted attack. There seems to have been, and they're still confirming this, that 10 suspects arrived in a white minibus. They entered this Jumpers informal settlement in Cleveland, which is east of Johannesburg, and they believe that they entered it through 2 separate access points and opened fire at multiple locations, and then they fled. So unfortunately, the result is 12 people are now dead, 11 died at the scene, and the 12th died in hospital. 9 others remain hospitalized and they are in critical condition. The victims include 9 men and 3 women. This is, again, one of the deadliest mass shootings in South Africa seen this year. And I say again because we have had many shootings. And whenever I report, I always say this has been the deadliest. But this one, unfortunately, happening yesterday around 11 p.m., that has been, until date, the deadliest one, Richard.
I'd like to pick up on what you've just said. You said organized and targeted attack. Do we know the motive, and how are authorities dealing with this latest shooting? So the arrests have been, unfortunately, none at the moment. And the motive is also officially unclear, because there is growing speculation that this could have been linked to illegal mining activity in the area, though police are very cautious about this at the moment. You might recall that Johannesburg is endowed with gold mines, and they have several around Johannesburg, and many have been closed in the past, yet some remain active when it comes to illegal mining. But what is clear, Richard, is that the scale of this response is huge. Detectives, crime intelligence, and forensic teams are all now involved in what police are calling a large-scale manhunt. This is a very dangerous area. Therefore, they have cornered it off and are advising even journalists not to go that close. But unfortunately, this type of violence and mass shooting will now raise a deeper question. And President Cyril Ramaphosa pledged earlier this year to crack down on illegal mining, deploying more security resources and even the army to troubled areas. But communities in parts of Johannesburg say criminal activity has never gone away. And so this attack will certainly intensify the pressure on government to act quicker, Richard. Julie Shire, Cape Town, thanks for that. We turn now to our continuing coverage of the Ebola outbreak. The World Health Organization says there are now 550 confirmed cases and 101 confirmed deaths in the Democratic Republic of the Congo. Health officials say expanded testing is helping to identify more infections, but significant challenges remain in reaching remote communities. CGTN's Sharon Baranga reports.
The WHO warns that the Ebola outbreak in eastern DRC continues to spread. On Tuesday, WHO Emergency Response Director Abdirahman Mahamoud stressed the need for early detection.
As of 8th June, there have been 550 confirmed cases with 101 deaths. The good news, we have 19 community recovered patients. So early identification and treatment saves life.
Health officials say the outbreak remains concentrated in Ituri province, which accounts for 94% of all cases. The increase in confirmed infections is partly due to expanded testing capacity, including a new decentralized laboratory in Mongwalu. Authorities are also working to strengthen contact tracing, a key tool in containing disease spread.
Contact tracing is one of the latest pillars of the response. As of now, we have reached 62% of the contacts, but our target is 90 to 95%. Where we are, it is a slow and steady progress, but we have not reached where we want to be. And that comes down to the community trust and working with the community.
The response faces significant logistical challenges. Large distances, difficult terrain and insecurity have complicated efforts to reach affected communities. Health workers are expanding laboratory services to speed up testing and diagnosis in remote areas.
Ituri is as big as France, so that's the landscape, that's what we're talking about. So places like here, you can get, if you are in Bunia, you can get your result in 1 or 2 hours. In the places that's far, you can get within 24 hours. With the decentralization of the lab, having a lab in Aru is the farthest from here that can take 7 to 10 hours by road. So by Friday, we'll have a lab there.
The Ebola outbreak of the rare Bundibujo strain was declared on May 15th. Officials later acknowledged that transmission had gone undetected for weeks. The epidemic is affecting Ituri, North Kivu and South Kivu provinces, which are already struggling under years of armed conflict. Sharon Baranga, CGTN.
Congolese authorities have been stepping up the Ebola response, but some resistance still persists within communities in Bunia, undermining the outbreak control measures. To help tackle this, local volunteers are now taking part in awareness-raising campaigns. CGTN's David Mbithi with that report.
In the heart of one of Bunia's popular markets, another critical message carrier is passing through this busy trading ground, balancing between clothing stands and a constant trickle of customers. Nadine Sumbuso is armed with awareness-raising materials to educate locals on Ebola prevention and has been doing this for the past 2 weeks. Her organization, known as Health My Priority, has been reminding traders of the essential measures they need to take to limit the risk of infection. But despite these efforts, some people here continue to doubt the very existence of the disease.
Before today, we targeted the Monique market to raise awareness among the public about the existence of Ebola virus disease, prevention methods, how to recognize the signs and symptoms, and how the virus is transmitted. There are some people who say that Ebola doesn't exist, and there is another kind of resistance regarding what is happening at treatment centers. When people come with stories saying that they have lost a loved one because they weren't properly treated, it discourages the public.
However, she has also met some who recognize and acknowledge the importance of the message she is sharing. One of them is a shopkeeper who lost a relative to Ebola and says another relative is currently admitted in a hospital. He is urging Congolese authorities to improve the nation's healthcare system.
We are asking the authorities to protect us. We need them to reassure us that they are capable of providing a complete cure, because we have had enough of suffering. I say this because I have already lost a family member to this Ebola disease. And I confirm that it is the Ebola virus disease, and I believe in its existence.
Sumbuso and her team believe that improving the healthcare system will be a key factor in restoring trust between the public and the medical community. But beyond medical considerations, researchers say the resistance observed in certain communities is also rooted in social and cultural factors. Funeral rites play a central role in the grieving process in many African cultures. When a family is excluded or not sufficiently involved in the final stages of caring for the deceased, this can interfere with the need to get closure after a painful sense of loss.
African culture is one that calls for us to take sufficient time to mourn the dead. But in the context of Ebola, a person dies suddenly and within hours. 3 hours later, their burial is rushed. And this is why communities are sometimes beginning to view the response as a war economy. Because the question arises as to why the burial is being rushed, as if there was something to be gained from it. Or they even suspect that the response team is siphoning off some financial resources, which is now fueling much greater mistrust within the community.
He says the lack of communal trust in Ebola response mechanisms is slowing the fight against the disease, calling for more engagement with treatment center staff and medical teams. The expert also advocates the use of digital tools to maintain a link between families and response teams during the treatment and burial processes. David Mbidi, CGTN.
When a country faces a dangerous disease outbreak, the world primarily asks for one thing: honesty. But right now, both Uganda and the Democratic Republic of Congo are asking why their honesty is being punished. After openly reporting cases of Ebola to international health bodies, both nations have been hit with swift travel bans, border closures, and the isolation from the international community. And as CGTN's Daniel Arap-Moy reports, leaders and health experts warn that these actions are setting a dangerous precedent.
For years, global health rules have told African nations to immediately report any virus outbreaks to help keep the world safe. Uganda and the DRC did exactly that. But instead of receiving praise and targeted medical support, they have been met with a wall of travel restrictions. Experts say this sends a terrible message. If you tell the truth, you will be locked away and your economy will suffer.
All actors involved need to pronounce themselves and denounce any unreasonable profiling, because that is going to really compromise public safety of the people who are being profiled, but also is going to undermine the very principles of public health, imperatives.
From both a medical and legal standpoint, experts say these broad bans on Ugandans and Congolese nationals are not based on science.
With full respect for countries' right to protect their citizens, let us be clear. Ebola is not an airborne disease. Blanket travel bans do not stop Ebola. They disrupt supply chains, they weaken surveillance and contact tracing, they discourage this transparency, and ultimately, they undermine global health security. I urge countries to reconsider and lift these measures.
The United States has imposed temporary immigration bans and public health-related border restrictions, preventing non-U.S. passport holders who recently visited the affected countries from entry. Canada, the Bahamas, Jordan, and Bahrain did something similar. Health officials have warned against such measures, saying they will simply force travelers to use illegal routes, making the virus even more difficult to trace. Rather than panicking with broad bans, they want the world to support transparent tracking so that honesty remains the best weapon against diseases. Daniel Arap-Moy, CGTN.
One person has reportedly died in central Kenya following protests against a U.S. plan to set up an Ebola quarantine and treatment facility for infected U.S. citizens in the town of Nanyuki. According to local media reports, police also arrested 50 people after firing tear gas at demonstrators who had gathered in the town early on Tuesday. It comes a week after 2 people were killed in similar protests. A Kenyan court has issued orders blocking the quarantine facility setup, pending hearings on the case. However, U.S. military planes have continued to ferry in staff and equipment, and that's according to U.S. and diplomatic sources, as well as flight tracking data. Kenyan officials are now claiming the facility would also serve Kenyans and foreign nationals in addition to U.S. citizens. But U.S. officials have not confirmed this.
We are saying no to Ebola. We won't allow Ebola to enter our country. We will not accept. We oppose this facility.
We don't want Ebola in this country, and we are peaceful. We are demonstrating according to the Constitution. The Constitution is protecting us, but the police are trying to tear gas us, and we are not going to entertain them.
Meanwhile, a Chinese medical expert team has met with representatives of the International Federation of the Red Cross and Red Crescent Societies in Kinshasa. The 5-member Chinese expert team arrived on June 2nd for a 3-month mission to support the fight against the Ebola epidemic. They discussed the epidemic situation, prevention and control needs, and potential areas of cooperation. Lu Ming, head of the Chinese team, expressed willingness to strengthen cooperation with Congolese health authorities, medical institutions, disease control agencies, and international partners. He said the team would work to identify the real needs on the ground as soon as possible. And over to Nigeria now, where Doctors Without Borders say that a cholera outbreak has killed 74 people and infected another 7,000 since May. Health workers in northern Borno State say so far cases have been reported in 14 of Borno's 27 local government areas. Most cases are reported in areas with dense populations, poor health facilities, sanitation challenges, and persistent decades-long insecurity, making it tough to contain the outbreak. According to MSF, last week saw a record 500 new patients registered in a single day.
I was infected with this cholera disease and I was taken to the hospital where I got good treatment. I was later discharged. I am now home feeling a lot better after the treatment.
Challenges that we are facing is the Borno State has the biggest densely populated population when the water and sanitation is not good. So that's making the situation worse. The open desertification is making it worse also, and there is less partners that are there. That is also not helping us too much. And by the time we know the cases in the community, the local transmission has happened, and it is difficult to respond because the spread has become more.
Nigerian kidnapping victims recently rescued from Boko Haram captivity are now sharing their traumatic experiences. Nigerian troops raided a heavily fortified Boko Haram enclave in Mandara Mountains of southern Borno State over the weekend, freeing 360 victims of abduction. CGTN Sharon Baranga brings us this update.
Residents of Ngoshe, a community near Nigeria's border with Cameroon, are recounting their ordeal after spending more than 3 months in captivity following a terrorist attack on their village. Nigeria's military says their rescue mission was driven by intelligence gathering. Some of the victims say despite enduring severe hardship, they were neither forced to convert to Islam nor were they subjected to sexual abuse.
The captors often said that the Nigerian authorities cared about our welfare, and they allowed me to communicate directly with their leaders. When we returned, the government responded quickly and helped us safely. Now I only hope to live peacefully in my community. My prayer is for lasting peace, stability and security in my community and across Nigeria.
Another survivor recalls the moment insurgents stormed her community and the challenges she faced during captivity.
We had just completed the dawn prayer and we were preparing to break our fast when we heard gunshot and explosions. The insurgents attacked our community and took us away. Life in captivity was extremely difficult. I became seriously ill. We are grateful to the military and the government for securing our release.
There are claims that a number of captives chose to remain with the Boko Haram insurgents, a revelation that has raised questions and surprised many observers. Borno State Governor Babagana Zulum visited the rescued victims at their temporary camp. He pledged support to those willing to return to their home, as well as those seeking resettlement elsewhere.
Here to support them with relief materials, food and non-food items. Each and every household will receive food and non-food items. But most importantly, we are also interfacing with the community about their return. Those that are willing to return to this community, we are working with the Nigerian Armed Forces, as well as other security agencies, with a view to establishing institutional arrangement that will ensure their dignified return. Those that are not willing to return to their hometown, Borno State government will do everything possible to resettle them in a very safe place.
The insurgency in northeastern Nigeria continues to pose a major security challenge, with Boko Haram and ISWAP militants regularly carrying out attacks across the region. Years of violence have claimed lives, displaced thousands of people, and left communities across Borno State struggling to rebuild. For these newly rescued abduction victims, the journey back to freedom may be over, but the road to recovery is just beginning. Sharon Baranga, CGTN.
Time now for our business segment. Here are the headlines. Coming up in business, inflation in Egypt defies the shock from the Middle East conflict and slows down in May. Kenya's Monetary Policy Committee maintains the benchmark lending rate 8.75%.
You don't find the stories of North Africa by sitting on the sidelines.
You've got to get out, go there, and you'll find them. In the bazaars of Casablanca. Among the crowds in Cairo.
Who come to visit Cairo, the ancient capital of Egypt.
Along the waters of the Nile. Along the sands of the Sahara. No one else will take you where we can in North Africa. No one else will show you what it's all about. CGTN, see the difference.
Welcome back to Africa Live. Thanks for staying with us. Egypt's annual urban inflation rate slowed to 14.6% in May, compared to 14.9% in April. This is according to the Central Agency for Public Mobilization and Statistics, which added that the annual inflation rate was 13% in May, down from 13.4% the previous month. According to the report, the General Consumer Price Index reached 292.0 points in May, a monthly increase of 1.4% over April. A previous poll conducted by Reuters had anticipated the annual inflation rate in Egypt would likely fall to 14.5% in May, citing favorable base year effects. However, analysts warned that this decline may be short-lived, with expectations that upcoming increases in electricity prices and other inflationary pressures will drive consumer prices higher in the coming months. Mozambique is pushing to restore direct budget support from the World Bank as part of a broader macroeconomic stabilization drive. This comes as the country hosted simultaneous high-level visits from the World Bank and the International Monetary Fund. Senior World Bank leaders attended a signing ceremony at the office of the Prime Minister on Tuesday. During the meeting, 5 financing agreements worth a combined $450 million were concluded across social protection, agriculture, water and sanitation, and education and skills. The country's finance ministry says the World Bank's development policy operation would be activated once Mozambique meets agreed benchmarks on macroeconomic sustainability, debt sustainability, and financial integrity in coordination with the IMF. Kenya's Monetary Policy Committee kept its benchmark lending rate at 8.75% during its meeting on Tuesday. This is despite the conflict in the Middle East disrupting global supply chains and leading to a sharp increase in energy prices and transportation costs in the country. Kenya's overall inflation increased to 6.7% in May 2026 from 5.6% in April, owing to high energy prices. But remained within the target range of 5+ or minus 2.5%. Core inflation rose as well to 3.2% in May from 2.8% in April, mainly driven by higher fuel prices. Non-core inflation increased sharply to 16% in May from 13.4% in April on account of higher energy prices, particularly fuel and gas prices. Meanwhile, economic growth is projected at 4.9% in 2026 compared to the previous projection of 5.3%, reflecting continued uncertainty. European Union regulators have ordered Meta platforms to grant rival AI chatbots free access to WhatsApp while probing whether the company abused its market power by blocking competitors. European Commission Executive Vice President for a Clean, Just and Competitive Transition, Teresa Ribera, told reporters in Brussels that the bloc's executive commission was taking action to prevent harm to competition in the growing market for AI assistance before it was too late.
It is now a critical time. AI markets are developing exceptionally fast, and AI assistants are expected to become an important way for consumers all across Europe to access and use AI. We cannot let large digital incumbents leverage their dominance of the past to dictate who in Europe gets to compete and who gets to innovate in AI. Today's measures will remain in place until our investigation is done, or at the latest until June 2029, 3 years from now. In doing so, we do not ask Meta to do something new, to implement some new technical engineering solution, or to put in place something technically burdensome. It is quite simple. We just ask Meta to go back to what they were doing by themselves until January this year, nothing more. This will allow the Commission to investigate this matter in depth while safeguarding competition in the growing market for AI assistance.
ChatGPT developer OpenAI has confidentially filed for an initial public offering in the U.S. The move follows a similar filing by its competitor Anthropic and comes only days before the planned listing of SpaceX. This wave of leading AI companies going public has further fueled worries over a tech share bubble, while also drawing in a growing number of retail investors. Mitch McCann has more from the New York Stock Exchange.
I think it's an interesting time when we consider what this means for investors, because right now this isn't really about the continued explosion in growth of some of the tech companies that are listed. In recent weeks, we've seen actually a sell-off in tech stocks. The Nasdaq dropped more than 4% at one point last week. So that is something to consider. I think there's a sense of concern and uncertainty around tech in the background around this possible bubble bursting. But I mean, we've been talking about this for more than a year now, and that hasn't happened, but there's still some concern there. At the same time, I think retail investors will be very interested in this because it does look like OpenAI and Anthropic are going from strength to strength, and these companies offer tools like ChatGPT, like Claude, that are so accessible to everyone. I think that will generate interest in itself, whether that's, the teacher who uses ChatGPT to help, design classroom tools, or the accountant who uses Claude to analyze spreadsheets. I think these tech products have wide appeal, and for some people this will be an opportunity to get into a stock that they understand. At the same time, as you've just talked about, money is being pumped into these businesses at a rapid rate. OpenAI valued at $850 billion earlier this year. Claude, slightly more, $950 billion. So real momentum there. All to say, I think there's likely to be strong appetite for investors, particularly retail investors. These are these mum and dad investors we talk about. But on the other hand, there may be some wariness over this tech bubble, or this possible tech bubble that we've been discussing as well. So it's interesting. They haven't said when they're going to go public. That in itself will be something to watch out for later this year.
Apple has announced a significant overhaul of its digital assistants, unveiling Siri AI. The iPhone maker also announced a suite of changes to its trust and safety features that would help keep children safer when using Apple products. The announcements were made at the company's annual Worldwide Developers Conference, which is slated to be Tim Cook's last as CEO before he steps down in September. Apple's introduction of Siri AI comes after criticism that the company has fallen behind fellow technological giants. The new version of Siri will work across other Apple products and apps, and will also feature a new app similar to what OpenAI and Anthropic offer for their AI assistants.
let's talk about our next set of releases, where we have some exciting updates to share. This year, we put our focus into 3 areas. First, improvements that make our platforms more responsive and easier to use in your day-to-day life. Second, updates in trust and safety, where we're building on our commitment to provide a safe and trusted platform for kids. And third, a big leap forward for Apple Intelligence, with an innovative architecture that unlocks a new Siri across platforms.
So it's going to live on people's devices as a layer on the operating system, so it knows what your emails are, what pictures you took, who you talked to. And what that means is each person will have their own Siri AI that understands what they need, how they use it, and with that knowledge can sort of serve as an agentic assistant.
Well, welcome into Sport on Africa Live with me, Richard Nta. Let's get going with football. Somali football referee Omar Abdulkader Artan has arrived back in his home country's capital, Mogadishu, to a hero's welcome after being denied entry into the U.S. ahead of the World Cup in North America. Artan, Africa's referee of the year in 2025, was set to become the first Somali to officiate at football's global showpiece, but was turned away by U.S. Customs and Border Protection in Miami over the weekend. World Football governing body FIFA said it was not involved in host countries' immigration decisions and had been informed that Artan's status would not change. This meant Artan would not be able to train or officiate at the tournament. Somalia's government said it had unsuccessfully tried to engage U.S. authorities and FIFA to secure his entry, calling his achievements a source of national pride. Upon arrival back home, Artan said he was in good spirits and thanked his supporters.
Everything that happened is for a reason and according to Almighty's plan. I would like to thank FIFA for the continued support during this process. I am hopeful to be part of the next World Cup and promise that to Somali people. Let's not give up as young people, especially here, because this is our country and our flag. We don't have any other, and we need to defend it come rain and sunshine.
We will have a big welcoming event by the sports fraternity and the entire citizens for our brother Omar Artan at Mogadishu Stadium to show our solidarity and support.
Meanwhile, U.S. authorities claimed on Tuesday that Artan was denied entry into the U.S. because of his alleged links to suspected members of terror organizations. The administration's immigration policies have been a point of contention ahead of the World Cup, with Washington imposing a sweeping travel ban last year on citizens of 12 countries, including Somalia. The Somali Football Federation said it had not received an official explanation as to why Artan was denied entry, adding that it was working closely with FIFA and relevant authorities to comprehend the situation. The Somalia Football Federation says denying Artan a chance to officiate at this year's World Cup will have a significant impact on him and the wider Somali football community. Artan was going to be the first referee from Somalia to officiate at a World Cup after making FIFA's final list for the tournament, which was announced 2 months ago.
The denial has now affected Omar Artan, a referee who earned the right to officiate at the highest levels of world football and truly deserved that opportunity. His refusal will definitely impact us because we wanted him to continue this work for which he toiled so hard. It will also affect not only the football community, but Somalis at large.